I think I'm on live now. Okay. Okay. Okay, so good afternoon, everyone, and thank you for attending this webinar discussion on COVID-19 and mental health. My name is Kathleen, and I am a co-founder and co-director of events for the Infectious Disease Working Group. Some quick housekeeping items before we begin. The session will be running until 1:30 p.m., and we're currently live streaming on YouTube, and the video will be recorded and available for folks later on our website at idwg.ca. Audience members can engage by submitting questions and comments to the YouTube comment section or by tweeting us at infectious_info. Please use the hashtags #InvisibleWave and #IDWG when sharing on social media. Now, if you have any questions or difficulties, please share them with us via comments or social media messaging. And if you are looking for mental health resources or want to support organizations doing related work, we have also shared a resource list in the video description and on our website. And finally, we want to improve based on your feedback today. So there is a form in the video description. Please fill it out, and at the end of the webinar, for a chance to win a $15 Tim Hortons gift card. So to begin, on behalf of our organization, I want to first acknowledge the land that we are situating on and on which University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. This land is a sacred land and has been the site of human activity for at least 15,000 years. This land is in the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy, the Confederacy of the Ojibwe, and allied nations to share and care for the land around the Great Lakes. Today, this meeting place is still home to many Indigenous peoples from across Turtle Island. As a racialized immigrant woman, it is important for me to understand and acknowledge the ways I've benefited from this land and in the ways in which my settlement on this land has perpetuated systems of oppression against the land's First Peoples. In context of today's discussion, I recognize that in public health and mental health, we have historically imposed our colonially rooted ideologies of health and well-being, and we have limited Indigenous peoples' ability to engage in their own healing and spiritual practices. Indigenous peoples have the right to self-determination. They have the right to create mental health services and safe spaces that serve their communities in ways that they see beneficial. So as privileged individuals, we must use our power to speak on these injustices and amplify the voices of those who have been silenced. July is also Black, Indigenous, and People of Color Mental Health Awareness Month. And so we're grateful for the opportunity to bring attention to the barriers these communities face in receiving mental health care. Over this discussion, we hope to engage in dialogue about creating systemic change that centers the experiences of these communities beyond just the month of July. Now, I'd like to share a little bit about the Infectious Disease Working Group. At the beginning of 2020, our group was formed as a public health student-led initiative based out of the Dalla Lana School of Public Health at the University of Toronto in response to the uncertainties around COVID-19. We witnessed a swift response in scientific and public health communities around the world, but we also saw the spread of a lot of fake news and mounting barriers to accessing resources in all communities. From this uncertainty, our mission became to synthesize, share, and exchange information and resources on COVID-19 to improve the health and well-being of Canadians and those affected around the world. One of our key values is to be transparent about what we do and do not know. We also want to use our platform to give voice to public health issues and ask the hard questions of ourselves and of those around us, challenging ourselves, challenging our communities and our governments to do better. This part is part of why we put together today's webinar on COVID-19 and mental health. The pandemic has had a profound impact on communities, highlighting neighborhood disparities in health, resources, access to care, and risk. We have brought together folks with different mental health expertise and perspectives in policy, medicine, community advocacy, and with lived experience to discuss the problems, the solutions, and the future of mental health through COVID-19. So this session is going to be moderated by Dr. Francisco Ibanez Carrasco, who is an AIDS activist, educator, researcher, and writer. And he is also recently appointed as an assistant professor of learning innovation at the Dalalana School of Public Health. So we are very excited to have him here today and introducing our panelists. I would now like to turn over the stage to Francisco.
Hi, how are you doing? And thank you so much, Kathleen. It's an honor for me to be here. I'm thrilled that I am at the Dalalana School of Public Health, and I am even more thrilled to be working with the infectious disease working group. They came to me and they're super talented. Now, of course, I'm grateful and thankful for being in this land as a settler, a Latinx, a gay Latinx, and super excited about the interviewees, the folks that are going to be talking with us today. We know that COVID-19, my apologies, has collective impacts on the mental health of many communities in the GTA and, of course, across the globe and across Canada. People are might be isolated, cooped in small places, unemployed, and at a risk of a number of different things. We're going to hear about those factors and those situations. We know that social services and health services are operating in limited and remote ways, and we want to know how they're coping and how our guests see this, that folks are coping with this new order of things. We all seem a little bit edgy, but I invite you to look within yourself and think about the ways in which we can show solidarity and move forward. Our guests, and I noticed that we didn't introduce them, are Dr. Anna Banerjee, and you can find a much longer presentation or introduction to them in the attached materials to this meeting. We have Floydine Charles Friedel and Dr. Farah Mawani and Dr. Haley Hamilton. And we've made friends very quickly. And I'm going to be very insolent and call them by the first name. I think they've mostly allowed me to do that. So thank you for being here. Let me start at random with one of you to give us your remarks. So Anna, if that's okay, would you just take 2 or 3 minutes to tell us what is the landscape you are seeing in terms of COVID-19 and mental health in the GTA and farther?
Okay, so I wear many different hats. I'll start with some of the work I'm doing, the smaller parts of the work I'm doing, and I'll talk about the bigger issue. So, and how much time do I have?
Well, give us 2 or 3 minutes so we can keep the conversation flowing. Don't worry, okay. I'll come back to you.
So one of the things is I call people with their COVID results. And so I know that a lot of people that have negative tests, but they have symptoms of COVID. And so I've talked to probably 2,000 people over the phone in the past little while. And in general, in Toronto, people are stressed. The general person, whatever their race, their ethnicity is, people are stressed. But then you have people that have, more vulnerabilities. They're even more stressed. So that's one of the things I do. The other thing is I have been working with Indigenous peoples. About the past month or so, I've been asked to join the COVID task force for NAN, so Anishinaabe Aski Nation. I'm an infectious disease public health specialist. And so through them, I'm helping them go through their policies, revise their policies, and trying to deal with some of the issues that northern remote First Nations communities have as far as dealing with COVID. And I can talk about that later if you want. I'm just giving you an overview. And then in the past, since COVID started, I recognized with some Indigenous leaders that there's really a lack of this chronic underfunding as far as Indigenous communities. And then on top of that, you have COVID. So it exposed a lot of vulnerabilities. And we know historically that a lot of Indigenous communities, when they've had a new virus come into the community, it can have it's had devastating consequences, like smallpox has wiped out communities, even H1N1. And so I started a petition with one of the former chief of Ontario to try to get more resources for Indigenous communities, and gave instructions as far as the need for rapid testing, the need for ramping up as far as human resources. So we had a list, and we have now over 55,000 signatures. And about 2 weeks ago, we gave the petition to the Prime Minister's office. So those are some of the things I'm involved with.
Amazing. Thank you. And we definitely will go over, we'll go back over some of those things. Dr. Haley Hamilton, Haley, if I may call you, tell us what you're seeing. What's the landscape you're seeing?
Well, I think that we're seeing the effects on everyone. Much of my work focuses on monitoring mental health and substance use within the Ontario population. And when this started, in addition to seeing how it impacts our own work, because we're all working from home now, and some of that, and we can see some of the impacts of that in ourselves and in our families. But in monitoring mental health and substance use within the population, we had the opportunity in May to collaborate with an organization, Delvinia specifically, to collect data, Canadian data, on how individuals are experiencing, what they're experiencing: mental health, anxiety, feelings of depression, feelings of loneliness, binge drinking, and just changes in alcohol use. And so we've conducted several waves of that study, looking at COVID and worries about finances, worries about getting COVID, working from home and the impacts that has had on anxiety. And what we've seen is that anxiety over the 3 waves, we've collected 4 waves to date. 3 are available on the website at CAMH. There is a dashboard. And so we've seen that there's been some decline early on in May in anxiety, but it's remained pretty stable since. Feelings of depression, feelings of loneliness have pretty much remained stable as well. But we can see, even within that data, those differences that we've noticed, such as age differences. Young people are experiencing higher levels of or more issues than older individuals. We see that women, for example, are more likely to experience anxiety than males. We see that those with children under 17 years of age are also more likely to experience anxiety. So we can see some of the differences. We asked about some data on race ethnicity. We don't have enough numbers as yet to really look in detail, but we can see from the data that we have collected during the pandemic that the pandemic has had an impact on Canada, on individuals within Canada, but also in some ways differently, which is some of what we're here to talk about today.
Right. Thank you. And so you literally are taking the pulse of these communities, with actual tracking instruments. That's super interesting. Now, Floydine, your turn. What are you seeing?
Good afternoon, everyone, and thank you so much for the organizers for having us on this panel and this very important discussion. I am the operational lead for the Caribbean African Canadian Social Services, which is located in what's affectionately called as Toronto North. We are also located in a community where there's one of the most highly densely populated groups of vulnerable populations, racialized groups, and in particular people of African descent. So what we're seeing really is an exacerbation or a heightening of what we already knew to be existing in our communities around the disparities in accessing health, how the social and economic, financial, and mental determinants of health have been playing out in our communities. So we are also seeing the impact that this is having on our staff, staff who have also been impacted significantly because they too have families and children. And when these issues rear their head, we see significant observation is that we have really seen the impact of how anti-Black racism plays out in systems and structures, and the barriers that have been created, and also the need to look at all of this through an equity lens in terms of the work that we're doing, because there is a disparity in terms of how the response to COVID-19 has been. I don't think that that's a secret to anyone. And one of the things that our organization is now involved in is that we have partnered with a few other entities on a research project led by Turner Consulting Group, because we're very much interested in finding out the impact that COVID-19 has had on our not-for-profit organizations and their staff, and how that trickles down into communities. So apart from now spending way more money to feed people and to provide supports, and looking at the mental health distress that we're seeing on a number of different levels in our youth, our children and families, is part of the work that we're doing. Our workload clearly has quadrupled as a result, as an organization that is in community providing direct services. So those are just in summary, some of the things that we're noticing up at CAFCAN. Thank you.
And of course that paints a picture, and we need to explore a little bit more of that. But I'm going to move very quickly to Dr. Farah Mawani. Farah, if I may, and please, what would be your opening remarks? I mean, we're painting a fairly bleak picture here across the communities.
Yeah, so I just want to start by saying I'm based at the MAP Center for Urban Health Solutions at St. Michael's Hospital, Unity Health Toronto, and the Faculty of Environmental and Urban Change at York University. And I, definitely want to echo what others have talked about, and particularly what Floydine was just sharing about, the differential impact of the pandemic and public health response on different subgroups of our population. So much of my work, or all of my work, focuses on that. I'm doing that in a range of contexts. So I'm a co-investigator on the COVID-19 and marginalization study that is evaluating COVID-19 programs targeted to marginalized groups in Toronto. We're, learning, trying to learn about these particular responsive programs in order to improve them and hopefully scale some of them. I'm also adapting Building Roads Together, which is a peer walking group I designed, and I'm having to adapt it to the COVID-19 context because the original design relied on a lot of kind of in-person, face-to-face contact. But because it was designed to address social isolation in particularly among low-income communities in Toronto, it's especially important now with the increase in social isolation, due to the public health response to the pandemic. So in addition to adapting it, I'm working to scale it in Toronto, in Canada, and globally. So I recently submitted a proposal to scale it to youth in low-income districts in Bogota, Colombia. And we're hoping, if we're able to get funding for that, I'm working closely with partners there, that we can learn from that experience in order to then apply it to youth here, because there's so many commonalities in the issues they're facing right now in this context. I'm also developing research to inform policy responses to reduce the impact of COVID-19 on precarious workers in Ontario, and then on a larger scale, synthesizing existing research to advise the UN on what research is required, to address socioeconomic recovery from COVID-19. So that's a snapshot.
Here, of course, and it's not a surprise across the various pictures that have been painted, if I can say it that way, by all of you, that whatever was happening before wasn't really the best and it just got worse. But I'm also hearing about adapting, particularly when public health is telling us at times, I mean, we seem to be coming out of that, but there's a lot of uncertainty in the future. And public health is telling us, no, don't get out of your house. And I hear from all of you things about adaptation of the services to online. Floydine, do you have a particular example? Can you think of a particular story in which you've had to adapt something that you used to do in person to an online? And I'm not saying successfully. I mean, some things are really difficult to adapt and it takes time. But can you think of an example and a story that brings us there?
Well, we know from the data that violence against women has increased by a large number. And so trying to run a program online in spaces where people are not able to practice physical distancing further challenges the problem. So we've had to find creative ways in which we offer programs. I can't go into the details on this call, on this conversation, obviously, but have had to be creative in that sense to create access. I think one of our programs that has been impacted most is our SNAP program, which is a Stop Now and Plan program, which is a program that actually engages the child who is the client, the sibling, and the parent or parents at the same time. So this program is offered where we're running 3 simultaneous groups on site during the same time. That's really one of the unique aspects of the program, and not being able to do that has posed a bit of a challenge for us in having, and our partners who have the same program, to be able to figure out how to make the adaptations. And because our program is one that was funded to do the cultural adaptation, it creates a little bit of an even greater challenge, because now we can't do that. Children are in the home, some are in apartments with their parents and their siblings, and they don't have access to Wi-Fi sometimes, or data, and all of those things that are required for people to even participate online.
Right, absolutely, and you've hit a number of really important points about access to data plans, and of course it's about money, it's about where do you put the resources. We're expecting all children to be studying from home as far as I can remember. So Floydine, you mentioned some creative adaptations, because I think you're doing, the way I hear you is you're doing 2 things at the same time, adapting culturally and adapting online, and it's a challenge. Can you think of a particular moment in which you thought, okay, that works online?
Sure, I think there's been a lot of advantages during this pandemic, because it has forced many of us to remember how creative we are in the first place, and take us back to the time when we didn't have phones and computers and all of these things, and figure out how then do we engage people differently. We're not perfect at it yet, but it's certainly an ongoing conversation, and I see it working. I think online causes people to connect in a different kind of way than before, and it requires a lot more work and resources, obviously, to ensure privacy and safety. And that's the challenge of it, is because the resources required to do that, many organizations do not have, but certainly have to be prepared to find a way, because this is where we're going to be for a long time. So yes, I think there are huge opportunities for people to connect. We have a project called Minding Our Minds, for Black folks to just exhale on a Friday to be able to talk about how they're dealing with this crisis and this pandemic in their own work. And connecting online allows people to be able to meet people that they otherwise would not have, just like I'm meeting all of you all today.
Cool, cool. Okay, thank you. So, Haley, if I may go to you with a very similar question. Tell us about ways in which you have seen or you are doing it at the moment, you're expecting to modify significant mental health services or supports for ethno-racialized communities to this online new world. If you can think of a particular story, or give us an idea of how that's been done.
Well, I don't work directly with youth. I am more on the research end, but there have been many occasions and examples of us having to adapt research to meet the current needs. And I think that with much of the programs that we have or interventions that we are working on, even within schools specifically, I can give you an example of, instead of going into schools, for example, to deliver interventions to students, the students are no longer there. So we've had to think about how are we going to deliver interventions to students who are outside of school, especially now when we're still uncertain about exactly what the schools will look like come September, come the fall. So, the move to virtual is absolutely necessary. So we've all had to think about how to deliver our projects virtually.
The folks. Okay, host, don't mute me up, because then I can't have a chat with Haley here. Tell us, have you thought of like, oh my God, this is how we're going to do the intervention that we used to do online? Is there a particular plan you have in mind, and that you're hoping is going to work well and not create more anxiety? Because there's all of those things we're talking about, and then heightened by the anxiety is like, is this thing working? Are people hearing me? Do I have headsets? A million things that used to seem very, very banal, but all of a sudden have become important. Any particular trick or strategy?
Well, I think for us, because we're focused on doing actual research on these interventions, we've had to think very strategically about design and how to measure these changes and how to accommodate these changes, but also the impact they will have on not only whether interventions work, given that things have changed, but also ensuring that youth feel comfortable with this new method of delivery. I mean, we talk a lot about the changes to virtual care, the shifts to virtual care, but we also have to think about to what extent people are comfortable with this new mode of delivery. We have to think about people's concerns about privacy, for example. We have to think about the digital divide, even though, technology is supposed to reduce some of the gaps, but you have to think that sometimes it also widens it. If there's lack of knowledge about how to use certain technology, it's not available in certain communities that are far further north, for example. Bandwidth issues, which we all now face with our Zoom calls. So these things are all important to think about. So there are definitely advantages with moving to virtual care, but there are also things to think about and the potential impacts it might have on interventions, and then the extent to which they work, and we really have to assess those.
For sure. Okay, thank you. And I'm going to actually ask you the same question. So in your practice, and by that I mean all the different things you do, how have you planned, or have you had the chance to try something new? Has it worked or not very well, in order to provide the services or help people provide the services they provide in terms of mental health in the communities? Oh, got it.
Okay. I also work with refugees, and I screen all the newly arrived Mrs. refugee children coming into Canada. And one of the impacts, again, on mental health and directly on health is that because of the border closures, they're not coming. So again, there's that uncertainty, the wait, But actually this week, in 2 days, I will see my first new children coming in from overseas since the pandemic started. Now, as far as the Indigenous populations, I mean, they started having their planning, COVID planning committees and meetings before I became involved. I can tell you a little bit about some of the stresses and concerns and some of the ways that we've been working, mainly them and now more recently me. But I mean, Indigenous peoples feel very vulnerable in general as far as COVID because, when we look historically, as I said, you have viruses that come in and decimate communities like the smallpox and measles. But recently, when H1N1 came and people were dying and Indigenous people were ending up in the intensive care unit, at 6.5 times the rate of non-Indigenous peoples, people asked for support from the federal government, and what they received are body bags. And so, right now, with the onset of coronavirus, there's a lot of issues and one of the big ones is really the lack of trust, because if coronavirus goes crazy in the communities, who's going to come to help? Can we trust the government? Are they just going to send us body bags, and are we going to be left on our own? And that's one of the reasons why we started the petition, where we said you need to put more funding and resources into Indigenous communities and address the acute needs to manage the coronavirus. But also, you need to start addressing the systematic underfunding of communities, such as the lack of clean water, the lack of safe housing, the overcrowding. We've got food insecurity. All of those things increase the risk of mental health issues, but also increase the risk of suicide. Just not directly from that. It's really colonization and everything that happened, residential schools, but the current situation as well, where, if you don't have access to clean water, what are you telling the communities? You're telling the communities that your life doesn't matter, that you don't count. And so we started the petition, and there was some response. We said we needed rapid testing, and they're working on it. But I think what's happened is that the communities have decided to take control themselves. And so their way, especially since this threatened the elders, the knowledge keepers, and if you lose the elders, then you lose a lot of historical knowledge from the past to the future. So that was a big threat. So the communities basically said that they weren't going to wait around for the government to do something or not do something. So that what they did is they put in lockdowns. And so they restricted access in and out of the communities. And so I think that's been highly effective in keeping COVID out. But the results of that is that you don't have dentists coming in, you don't have doctors or nurses coming in. So you're not getting the baseline healthcare, which is really poor to begin with. You've stopped that. So people aren't seeing their diabetic nurses. The mental health issues, the chronic mental health issues, but also the stress and the uncertainty, the lack of trust, the chronic underfunding for communities has made it very, very difficult for these communities. And so you see, every week we hear about the suicides that are going on, mainly the youth. And, so horrible situations where you can't have funerals, you can't do your traditional, ceremonies to respect someone as they pass on. So you've got increased rates of suicide. There've been increased rates of domestic violence, and there's a terrible amount of stress. Just saying, how long is this going to go on? What are we going to do? Will there be food shortages again? So I think the communities have done a great job in working with partners and developing their strategic plan. I think their plans are good, but what we really need is resources to address, the rapid testing. We need to have the rapid testing in these communities, and they're looking at it, but they haven't occurred yet. But also funding to address the chronic, long-term neglect that has occurred with Indigenous populations.
Thank you. So, in the same vein, I'm going to ask you, Farah. Well, it seems that you folks are contending not only with something new, in this case, the new factor would be COVID-19, but with a bunch of historical things, is this the right time to try to take on to a whole large social project, or would there be a particular area where you think the efforts should be focused? And this I'm not saying to belittle the project of dismantling patriarchy or colonization and those things. I mean, clearly we're all on the same side, but we're saying to people, wow, we have all this going on and we need to dismantle it. And you need to be careful with COVID, and no, we cannot have nurses and doctors and dentists coming to the community. So where do we start?
Are you asking that as a follow-up to?
Yes, and to throw in your own thoughts.
Well, I think, I can't really speak to her work specifically, but in terms of my perspective, I think it's really critical that we address health inequities, social and health inequities from the start. We've seen some of the negative impacts when we think of it when they're an afterthought. When we don't address social and health inequities from the start, we risk increasing them rather than reducing them. So briefly, that's what I would say to that. We certainly need to be addressing that from the beginning, rather than going with the misperception that COVID-19 is the emergency because it's an infectious disease, so we have to wait to deal with everything else.
Right. So I'm hearing you're proposing to move with a number of things at the same time. Haley, what are your thoughts on this? I mean, as an individual, I see there's so many places, and again, the question is the same: where do we start, and where would you suggest a community, say, you work with, could start, instead of saying, oh, you have to do all these things at the same time: fight racism, fight patriarchy, fight colonization?
Well, I think that it's some of this is these are long-standing issues, and I always go back to the social determinants of health. That's where I go back to, because I think that more and more others are beginning to realize how important these determinants are to people's health, how important income is, how important education is, how important race, ethnicity are. These are important things that we know impact health. Gender, age, all of these things are important. And I think when you try too much to kind of separate them and look at things as, oh, this is what is happening to the context of all these other things and all that they're experiencing, then I think it becomes extra difficult. So where do you start is a difficult question to answer when there are so many factors that are impacting lives and experiences. So it's almost as if it's okay, whatever you can do, please do with respect to any of these issues, because especially for certain communities, it's more severe than others. But it's important to address the social determinants of health.
Okay, so Floydina, I'm going to go to you and ask you in the same vein, that where has your community, you mentioned some programs like Minding the Minds, and I think it was for youth, the kids are getting together online and you're trying to kind of adapt that. What other places would you start this work, not only in relation to mental health and COVID, but to try to keep the other projects ongoing, right? The dismantling the racism, the patriarchy and colonization.
I think it's a multi-pronged process. There's the place around programs and services that we do what we can internally. And then it's the places around the systems and where we try to influence systems change, right? And work with other partners, members of different levels of government, for example, to understand the impact. So when things like funding, and I'm sure you all are aware of all of the money that has been allocated to COVID-19 and to communities and so on. It because there has not been really a what's the word I'm looking for? Really a lens per se on doing research and data collection in any kind of way that could provide evidence now. I mean, now you're starting to hear about the impact of the pandemic on racialized groups and Black communities and the increase in suicide, the attempts to complete suicide, and all of that. But I think it has to be with an understanding of how we work towards affecting policies, changing the policies that exist that continue to support this, because this problem and this challenge is beyond money. It's beyond money. Food's gonna run out, and we talk about food security and food sovereignty, but how are we building and looking at strategies to build within communities their own capacities to better be able to respond? How are we working with the organizations, the not-for-profit sectors, to build their capacity financially and human resource wise, when traditionally we're underfunded, completely underfunded compared to our other part agencies in the community. So it's a very big question. I think it's a conversation that requires a lot of navel gazing, and quite honestly, I'm not sure people are prepared for it, because
All
then it
right. Well,
challenges some of the systems.
okay. Let's. So, Florentine, I just wanted to ask you in terms of the funding, and because you mentioned, and I think the public opinion has been. Well, everybody seems very satisfied with all the monies that have been given out, not only to organizations and through local governments, but also to researchers. But is that what you're seeing from your experience at present?
No, I mean, that means the everybody doesn't include us, because we certainly are not satisfied. And the groups that we're associated with have been advocating for the past several months around the manner in which these funds are being allocated. So I would not agree that everybody is satisfied. I think people look at dollars and they don't do the math to figure out that the cost per person is less than what you can buy a Big Mac for, really, when you do the math.
Yeah, no, oh, here I am. Thank you for that. And I'm going to transport, if I may, that same question about, there's been a lot of calls for research, a lot of calls to approve research funding for COVID in many areas. Anna, and are you satisfied with the ways that those research dollars, as far as you can see, are being utilized?
Well, I mean, there are places in Canada, in Toronto, where they are looking at antibody testing as well as vaccination, and so we're moving ahead. But does every single country in the world need to independently get a vaccine? When I go back to, we don't have people having clean water, and so billions, just like that. Billions of dollars were distributed to different communities and different populations to keep most people, surviving from one paycheck to another. And I think it was important. But the fact that they could, with the political will, implement something to have a major change. Why can't they, like that, implement clean water or basic human rights? And I think what needs to happen in some of this is that a lot of these things, like access to, whether they're Indigenous or Black or whatever minority, but make it part of our well, human rights, but also part of our laws. Make it illegal not to have a community with access to clean water, and make sure every level of government's responsible. Make sure it's illegal that we have systems in place where children don't have access to food. You know, in Indigenous communities or impoverished communities, you can put in breakfast programs. There's a whole list of things that you could do. But so that tells me in a time of a crisis, the government can respond and give lots of money to different things. And some things are probably more effective than other things. But why can't they, when there are serious things that impact the determinants of health for certain groups that have been more chronic, that they need to take care of, I think, right away.
Right. So it seems what I hear is not only to solve the immediate problem, like how do you pay the rent next month, which you suggest is somehow worked, but it needs to be predictive. You know, it needs to say, well, things are, I give you money for this 2 months. It doesn't mean that your future is fine. And in the same vein, I want to ask Farah about, especially if you have an example, what government or organizational project or policy has worked really well and what hasn't in the last 3 months?
Well, I think one of the challenges we have now, we can't really talk in detail about what has been effective without evaluation. I mean, everything has evolved quite quickly, and you know, we don't fully know the impact of government interventions. Though we can talk about the extent to which they're being responsive, and many government interventions at all levels of government have been targeted to the whole population, without focusing specifically on inequities and on groups who are at higher risk of contracting COVID-19 and experiencing serious consequences of COVID-19. So, I would say that's a key gap. There hasn't really been adequate health equity impact assessment during, policy development and implementation. Because as I said earlier, if that isn't done, you can risk increasing inequities by implementing policies. And, I would also say that there's been limited attention to addressing structural determinants. So, and I'll give an example with migrant workers. There's been a focus on one of the responses is that we have to provide mobile testing because the issue is that they're not getting tested and therefore it's spreading, rather than looking at what is putting them at high risk in the first place, and what are the structural determinants, what are the policy, what's the systemic discrimination that is causing them to have immigration status tied to working for a particular employer, that isn't necessarily ensuring that they have a safe workplace. So that's one example.
And in that example, Farah, do you think that we've shown maybe our true colors and we're very protectionist and saying, okay, yes, we're all in trouble, but we need to keep ourselves, in better shape than others? I don't know, just as provocative, but I'm asking you whether you see a lot of protectionism or even NIMBYism, not in my backyardism.
I think what I do see is communities who are at high risk and then are therefore, having higher rates of COVID-19 being blamed rather than the focus being on, what's putting them at higher risk and what's the injustice that's putting them at higher risk that, we need to address as a society.
So I'm going to put you on the spot, all of you, by shifting gears a little bit, obviously on the same topic, but now kind of picking your brains and your experience, and think of what are the things that you've seen, either from government or local organizations, your own research, students, the various places that you visit, either virtually or in person every time. What are the things that you've seen that give you hope, that you think, oh, that's an interesting way of dealing with this, and I hope more of that. In I'm asking you to focus specifically on things that people like to do. I mean, we all should and are serious about some of the really bad things that are happening, but we also want our youth and people to have a good time and do the things that bring joy to them, getting together, dating, keeping their sexual health, well, and being well, not being lonely. So, Anna, if I may start with you and ask you, from your vantage point, what have you seen that gives you hope, and you think, oh yeah, that really brings people in, and in spite of the situation, they're kind of like flourishing, or they could thrive even more?
So, I'm going to go back to basically the government response, where there's been consistent messaging. They told us to stay at home for like 4 months, and everyone did it. And so I think it's that sense of community. We're on this together, versus, like, for example, the States, where it's, like all the messaging is all mixed up. And so I think it's extremely stressful for people to be at home for 4 months, for some of them not to have an income, not to have, they can't pay their rent. So there's a lot of stresses there, and not being able to isolate and to socialize and stay in your own bubbles or keeping physical distance. But I think the thing that helps a lot of people is the way that we are doing it for each other. We're wearing the masks to keep us safe, but also to keep you safe. And so there's that sense of community, that everything we do for all of us. And I think so that's why people, even though, you say, well, maybe going into bars to socialize or picnics at the beach, and I'm sure that can help mental health if you do that in a safe way. But I think what helps mental health is that we're all going through this very unique, very difficult, stressful time together. And we are all making sacrifices for each other.
Thank you. And Haley, I'm going to ask you the same question. I mean, I'm Latinx, born and raised in Chile, and my people, have to say, have not been very good, as Anna was describing, at doing the keeping masks and things like that. We tend to be disorderly as a stereotype, but and I'm sure there are other reasons. But what are the ways in which you have seen hope through the communities you interact with, even among researchers and the people that you provide services with? What do they tell you? Like, okay, I can do this, and this brings me wellness, this brings me hope.
Well, I think I'll focus directly with my work, which is more data, at the data end of things. And in the study that I mentioned at the beginning of the programming, and that is, just looking at how mental health has changed since about May, and the decline, for example, in anxiety, feelings of depression, feelings of loneliness is really more stable. So I think, to me, that speaks to individuals adapting. I think we all had difficulty early on in working from home or shifting if you're trying to adapt. So I think that with now loosening and opening up, people are adapting better. They're less worried about their finances, which we can see in our data due to COVID. They're less worried about getting COVID itself. Many of them have returned. People are more likely to have returned, for example, to work if they were just off because of lockdown, because they're within their office. Those shifts and the switching from stage to stage is giving people hope, and that they're feeling that, geez, I'm adapting to this situation, but there's also hope on the horizon, in that I can now, see my friend at just social distancing. I can get together with a couple people, depending on which municipality you're in, and we can see each other in person again. So I think that is what I see from the data that I work with, that it's positive, and even in my everyday life.
Right. And yeah, people are finding new ways of celebrate and those kinds of things. It's very interesting to hear you say that people are less worried about their salary. And I take that to mean that things have stabilized for them a little bit more, or as human beings, they stop caring about money and possessions. Which is it?
I think it's our question is more about how worried are you about your finances due to COVID-19. So if you lost your job due to COVID-19, then you'd be very worried about finances. When the stock market went down originally at the beginning, that people who were close to retirement were very worried about their investments. People who lost their jobs were worried about their income. And so that was the main workup. There's some kind of people are where they have government support. So that has kind of relayed some of their worries. With respect to getting COVID, the numbers have dropped, so they're less worried about that. So it's multi-pronged, and it really depends on what your circumstances are, whether it's income or investments, or where your reduced worry is. It's what your reduced worry.
Okay, thank you. Sorry, Haley, it was a little bit broken up for me, but thank you. We got the gist of your response. I want to go to Floydine and very quickly and put this to you and see your reaction. I see that when working classes or people who are very cooped up in their places because they're newcomers or a number of other reasons celebrate, right? And they're seen as troublemakers, and they're seen as like, they are not being responsible and accountable. Do you think that that's a true perception on my part, or really everybody is being treated the same in terms of their coming out of confinement and quarantine? What are you seeing?
One of the ways that people of African descent survive is through celebrating. It's one of the ways that is inherent to us as melanin-blessed peoples, that we celebrate. Now, if you want to break it down further and talk about our youth, the analysis of that will come from a place of understanding young Black males who don't expect to live to the age of 18 anyway. This pandemic is not going to affect how they choose to socialize and interact, because they already expect to die. And these are the conversations that we're not having around how this is playing out in people who are already, and not just in the Black community, but how many people are already marginalized and vulnerable and cannot be physically distancing. But because you're physically distancing doesn't mean that you can't socially, practice social distancing. This is Carnival Week in Toronto, for example. We're heading up into what would have been Carabana Saturday. People are finding their own ways in which to celebrate that, whether they're doing online or what have you. But the stigma and the perception about people and not adhering to rules is a much deeper conversation in the understanding of the psyche of each individual when they already disenfranchised. Yeah. So I would challenge the privilege that is embedded in that perception of things. Yeah.
Of course, yeah, and Anna, moving on with the same question before we go to one more kind of hard-hitting question that we have from the audience. what do you think has driven the public opinion in your perspective, and how do we really support communities, right, that are seeing, as Floydine well points out, that they don't even expect to, live to a certain age? How do we support them in their ways of celebrating, their ways of socializing? And I know we all have to do it sometimes through computers and stuff like that, but what are you seeing? What are your at least your hopeful solutions for something like that?
As far as kids trying to socialize and trying to engage, and I think that in a productive way or in a more dangerous way.
Well, sometimes I think what happens with immigrant communities and working class communities is that what we consider our celebration ways are seen as even illegal ways of having fun. I mean, maybe I'm just referring to specific pockets of queer communities across the country that their celebration is very sexual, is using illicit drugs and stuff like that. Well, that's the way they celebrate, but for the most part, we see them from a moral perspective, and we're saying, well, that's not contributing to your mental health. So how do we validate people, and what are they saying from the different groups that you work with about, like, well, this is how I want to live my life, even through COVID, and how we can support them in that way?
So I think that, I'm a pediatrician, so most of the people I work with are kids. And that being said, I'm not actually physically seeing them anymore because all the clinics have shut down. But, and I talk to a lot of adults. I think that people are coping with drinking and doing, a lot of people are using cannabis and that. But I think one of the ways that we can support people is just to try to look at this in a long-term perspective. This is very narrow. It seems like it's going to go on forever. This COVID thing, their lives have changed. It's never going to go back to normal. And I think always reassuring to the youth and the kids, this is temporary. In a year from now, everything will be back to normal. Well, maybe a different normal, but this is, in the long term, we will all get through this. We will all survive. Everything will be okay. And it's okay to feel stressed. It's okay to feel the anxiety and all the feelings that you're feeling. It's normal. It's a coping mechanism. And I think for a lot of young people, they sort of given up after being in self-isolation for 4 weeks. They say, I don't care. I'm going to, there are especially new immigrants and refugees that have just come from war zones, and they're saying, well, stay at home because there's a virus. Well, we've got malaria, we've got tuberculosis, we've got all these other things, we've got guns and wars and that. So some of them are sort of saying, well, at this point in time, I'm ready just to go out and hang out with my friends because I need to protect my mental health.
For sure. Are young parents in particular, I mean, this is not to discriminate against parents who are not young, who are talking with you, are they giving you hints of what they think about this new future for them? Imagine that things might be the same, might change radically, are they kind of uncertain? What are they telling you about the well-being, the mental health, the future they see?
I think it depends on where they are and how secure they are. Like people that have resources say, well, okay, it's okay. I'm not traveling to Europe for whatever vacation, and I'm not doing this and that. We're fine. We have food. We've got groceries. If we don't work for a couple of months, it doesn't matter. But I think it's the people who are more vulnerable, that don't have the resources, that don't even have a balcony, that don't have a backyard, that if they're not working, they can't pay their rent, or they're losing, their precarious jobs. I think those people are much, much more stressed. And the kids are much more stressed because there's also the uncertainty. What is this going to mean for me in the future? Will I be able to pay my bills? What happens if I get kicked out of my apartment because I can't pay my rent? So I think it really depends. And that's why this virus is targeting people that don't have, who are less resourced in a much more pertinent way, and it has a lot more implications for people that don't have that network financially or otherwise.
Yeah. Thank you. And Farah, you've been scolding me because I forgot to ask you about to share with you the question about hope. So let's talk about uncertainty and hope and what you see in the future in the communities you work with or you have the chance to be informed about.
Yeah, I think I see, that at many different levels. So one level is the energy and the energy for and the commitment to addressing inequities among my colleagues, including community members who I collaborate closely with, and that's both here and globally. I would say there's been a great increase in collaboration to address these critical urgent issues, and in addition to that collaboration, I would say we've all been working extremely rapidly, projects and initiatives that we would normally take months, even years to develop and work on, we're doing in weeks. And, that means really long hours, but that commitment is really there. So I find that, really heartwarming and encouraging. And then I also see, really innovative responses from community partners. I work closely with community members and organizations in Regent Park, and extremely quickly, the Regent Park Sewing Collective, a group of immigrant and refugee women who were sewing, bags and other things to generate income prior to the pandemic. They pivoted very quickly to sewing masks and to a model where they were able to sell the masks quite cheaply, but also donate masks to community members who couldn't otherwise afford them. And then the organization that they're based at, the Center for Learning and Development, they're very quickly focusing on their expertise in transferring programming to online environments, but with consideration of issues to do with digital access, and that includes securing funding to ensure that community members can have access to Wi-Fi and the technology they need, but also digital literacy. Haley brought that up earlier as one of the barriers. So I'm seeing really creative, innovative ways of responding quite quickly when all of us are also personally affected by the pandemic and response.
And Farah, if you can plug, please, that program again, the sewing program. That brings us to the ground. I love when I'm hearing about Minding Minds and other programs, because I think they take everything we know and they put it in a real context. These people they exist. What's the name of the program?
So it's called the Regent Park Sewing Collective. And actually, I'm glad you asked, because they recently went online themselves. So I'll share the link. I'll see if I can share it on Twitter at least, or with the organizers. So, people can support them. That would be wonderful.
Please do. And all of a sudden those, it looks like influencers, if you know what influencers are, that, we're just advertising, I don't know, perfumes or gadgets. All of a sudden, we all want influencers actually in communities, right? That can advertise this kind of programs and say, hey, it does exist in your neighborhood, and they can see it through the Twitter or Instagram and those kinds of things. We're going to use the last minutes going around with one final question. And really it's about the organizers of the event have asked me to ask, in your mind, if you had to choose one or two things that current governments and organizations in the GTA, and I know we're talking broadly here, should be doing. And I think we've heard hints of that by saying, well, they should be funding this particular kind of program, or we've heard hints of that from you, but is there a particular thing with a particular way of moving it forward that you would recommend as your closing remarks that would really help the mental health of all communities, but in particular racialized communities? And I'm going to start with I'm going to start with Anna, if you don't mind. I see you're reflecting already on the question.
Yeah, so I'm going to go back to basic fundamental human rights. Now, Canada is a signatory to the UN Convention on Health being a human right. And so when we have things like equitable access to food, access to clean water, equitable access to healthcare, safe environment, safe living conditions, all those things. And right now, to me, Canada is violating a lot of those human rights policies. So I think that we need to have, everything based in a human rights framework, legislation, in laws, so that that things are illegal. Right now we have two tiers of systems where we have the non-Indigenous versus Indigenous, and it's okay, for most Canadians to have a certain group of rights, but when you have another group of people and they have different policies, differential funding, less access to education, health services, social services, and you have that differential, by definition, that's called apartheid. And we need to stop that, make sure that everything is based so that every single Canadian has certain basic human rights. And, again, so that there are incentives to make sure we do that, and consequences for not. And I think that all of us as Canadians should no longer accept the status quo for certain populations. And I think that we should all write to our MPs and say, unless you address, you can have a list, maybe a hierarchy, something as basic as clean water, that every single community in Canada needs to have access to clean water. And if you, my MP or MPP, doesn't do it, we're not going to vote for you again. This is important. And I think as Canadians, we need to start speaking up and saying, it's no longer acceptable. We need to do something about it.
And Anna, please, thank you. Those are powerful words. And if we can ask you to reiterate my apologies that, my mind is full of ideas now. But at the beginning of our conversation, there was a particular petition, I think, that you told us about. Is that something that you can share again, yes, please? And yes, how, if there's any way that any of us or those listening or viewing this program can participate.
So it's on change.org. So it's change.org/COVID-19 Indigenous. And we have, again, the more number of people that we get to sign the petition, the more the government pays attention. And they are paying attention. And they have made some changes, but we need to make more changes. And then in the future, we're looking at how we can lobby so that, they start implementing other basic human rights. So this is change.org, COVID-19 Indigenous. Thank you.
Thank you. Thank you. And I'm going to ask one of our wonderful co-pilots, I think it's Kathleen or Nushin, to actually write that in the chat room. And thank you for that. We appreciate it.
And sorry. And
go ahead.
Sign it and disseminate it. It would be very helpful.
There we go. Thank you. And I think it's been placed there. So I'm going to move on to Floydine with the same questions. There's one thing today that either you've started or that you think this needs to start now to contribute to the mental health, the well-being of the communities that you are directly in touch with. What would that one thing be, and who would have to do it?
I think we would need to create a movement for change. And that includes all of us in the different spaces that we're in. It's not just about Black people or brown people, it's about all of us because this is a public health concern. And we have to find ways to come together and mobilize to change, to improve the mental health status of Canadians, all of us.
Thank you. And Florina, is there any other, because people are loving your plug to the sewing, no, was it Farah, the sewing, but so Farah plugged the sewing group. And so people have one more. Is there a particular program that has gone online that people might help your community with that you want to tell us about?
Well, people are helping our community in a number of ways. They're donating to us because we're distributing hot, culturally palatable meals and over 600 meals a month and over almost 500 food baskets, culturally selected food hampers with plantain and edibles and Christophine and those things and vegetables to our clients and their families every month, because we understand that when people are stressed because their mental health status is compromised during stress, food is one of the things that bring comfort. And so to give people food that their palates are used to kind of ensures that we're doing one small thing to alleviate that concern. So people can contribute to CAFCAN. They can contact us at info@cafcan.org, go on our website to see the programs and services we offer. And if they want to support us, we welcome that. That includes volunteering every Friday to deliver food, the meals to our members in the community.
That's wonderful. Thank you. And I think one of our, again, co-pilots said will enter the URL, the web site direction. Dear God, I'm thinking like an old man. I can't remember how to say that. The link, this is what I'm trying to say, that you just suggested. So with the final question, again, I'm going to go now to Haley, if I may, and ask you the same question. And I don't know if Haley is still with us. Yeah, Haley, I'm sorry. There you are. So what is the one thing that we should be doing today for the mental health of our communities tomorrow, or even for the mental health of the providers and the researchers? I mean,
yes, I am.
What is the one thing you would suggest? And is there a particular venture or initiative that you want to mention today?
I will say what CAMH has been saying for a long time now, and it's stamped all over everything they do these days. Mental health is health. And I think we need to recognize that. Too often, mental health is given short shift. It's not considered important. But especially during this pandemic, we can see people are experiencing it. We know it's clearer that you're stressed. People are anxious. Some of them they're depressed. For healthcare workers, essential workers, they have to be concerned about PTSD. So mental health is health. Let's remember that, and let's try to reduce the stigma associated with mental health. So I think that's number one. And I think we need to do what we have said before, which is invest in just the social determinants of health. We need to provide, we need to reduce poverty. We need housing for those individuals who are having these experiences. We need to just proper income for individuals. Remove food insecurity. So we need to really address the social determinants of health as well. And moving forward, and I could say this as a more a broader based necessity in order for change, I think voting is one way that you can advocate for change.
Okay. And before I go, thank you so much, Haley. And before I go to Farah, I know Farah's reminding me that I need to say something. And of course, you'll have a moment. I was just thinking about the hamper with culturally appropriate food and things like that. It seems to me that we also now need to be giving families who can't afford it, laptops, headsets, if we really mean that people need to be connected online, if that's going to happen again in September. I mean, I remember this old development projects in other continents where we try to provide the kids with a connection to internet, things like that. Well, I think many of our communities are in the same place, and we could be helping them with those kinds of things. And of course, last not least, Farah, you're going to tackle kind of the same question.
Yeah, thanks so much. Yeah, I think I am really pleased with what my fellow panelists have shared, because I agree with all of your strong calls. And to add to that, I would say that, I think we really need to recognize that if there is differential risk of contracting, experiencing complications and dying from COVID-19, there is also differential impact on mental health. And people experiencing a greater burden of COVID-19 and mental health consequences of it should really be leading the response. We need Indigenous, Black, racialized people, for example, leading as researchers, as policymakers, as practitioners. And in many cases, these populations are not even at the decision-making tables. And so, to me, that is a really key thing that has to change for there to be, sustainable impact.
Thank you. Thanks. We're going to invite back one of the members of the organizing group of this event. But before I go, I just want to thank each one of you, truly. Dr. Banerjee, Floydine, Dr. Hamilton, Dr. Mawani. It's lovely meeting you virtually. And I truly thank you for letting me ask you questions. And I think somebody's coming from there we go. Kathleen is here. Thanks to this group as well. I'm now going to go to the background and I'll leave you with them. Thanks very much. I appreciate it.
Yeah, thank you so much, Francisco, and all the panelists. On behalf of the Infectious Disease Working Group, I would like to thank Farah, Anna, Floydine, Haley, and Francisco for their time and discussion today. You've really helped us better understand the landscape of mental health care and supports across our local communities. I'm really eyes open, ears open about all the initiatives that are around. And just to do a final plug on it, we've heard about the Regent Park Sewing Collective, the Mind Over Matters, and a lot of different programs at CAFCAN, the Indigenous Access Petition that we hope everybody follows the link to go and sign. The mental health that from CAMH, mental health is also health, and we do need to address it as part of the social determinants of health. And the differential impacts on mental health really need to be, the solutions to these problems really need to be led by the people who are experiencing those, experiencing the barriers, and putting their voices at the forefront is so important for all of us. And my final thank you goes out to our audience members for attending, for sharing your thoughts and comments, and really for sharing your time as well during a period of a lot of Zoom fatigue, and providing your experiences and lived experiences for our folks as well. We hope you continue to engage in this important topic and look to find ways to act on what you've learned today. I know I certainly will, and so will our group. We'll be sharing all these links again on our website, on our social media, and look out for those. And I would also like to remind folks that these resources for mental health, as well as the supporting organizations, are on the link provided in the video description, as well as on our website at idwg.ca. And finally, your feedback is really important to all of us, so please fill in the form that's also in the video link description, and you'll also have a chance to win a $15 gift card to Tim Hortons. So finally, stay connected by following our social media and by following our panelists as well as their organizations. There's a lot of great stuff happening around in Toronto, as well as different ways to be creative and celebrate what we do have right now and work towards peace and justice for everyone. So thanks again for joining us. I hope it's been a motivating experience, Hope it sparked a new thought, created a small change, and made a change in you. So stay safe, stay informed, and be kind to others, and definitely be kind to yourself. We hope to see you again at our next session. Thanks, everyone.